We are 9 months into this pandemic, and right now it's not slowing down, it's picking up speed.
That is the governor of Wisconsin, which is one of 31 states now seeing growing numbers of COVID cases. More than 207,000 Americans have died from this virus. We're still averaging more than 700 fatalities each and every day. The United States also has more than 7 million people who have tested positive. A lot of people believe that number much higher, those that just haven't actually tested. But we already know the physical number of the 7 million. Now you have 100,000 plus people who call themselves long haulers, meaning they have been battling health-related issues due to COVID for months now. Now, over the past few weeks, we've been speaking with many of these folks. Now, if you've had COVID and you'd like to tell us about your experience battling it well after the 2 weeks that you contracted it, we want to hear from you and perhaps even have you on the program to share your story with us. Please email us at rfl@rnntv.com. You can also send us a tweet, our handle at LarryEP13. My next guest, she, a long hauler. Mary Kate Boughton, she caught COVID back in March, then started to feel a bit better, but she had a relapse in July and had to go back to the emergency room. She has suffered from a slew of new symptoms like rashes, blood clotting, nausea, confusion, shortness of breath, and unfortunately much, much more. Like so many folks we've spoken to that are part of the survivor corps, your stories are certainly not, unfortunately, unique. There's a lot of other people going through what you're dealing with now, and the numbers are staggering. But let's walk us back, if we can, to pre-COVID. You were healthy, you ran, as I understood, like 3 miles a day and exercised regularly. And you're not exactly sure how, you caught COVID, and it didn't seem bad at first, but then all of a sudden you realized that you were dealing with something that wasn't just a simple virus.
Yes, I was a very healthy 40-year-old prior to contracting COVID. I did run 3 miles nearly every day, also cycle, play tennis. I got COVID in something like early or mid-March here in New York City. And for me, it was actually what we now know as somewhat of a moderate/severe case of COVID. As part of my illness, I honestly did not really feel like I was going to make it for a few days there. And at one point on March 24th, a friend of mine who's a nurse called a car and sent me to the ER. That experience was very interesting. At that point in New York City, they were directed not to admit anyone who wasn't in an immediate life or death situation. And the doctor that I saw, she actually had tears in her eyes when she told me she was going to have to send me home. All she could do was give me a Z-Pack for the pneumonia, but she said she was so sorry to do it. And in normal times, she would have definitely admitted me because she didn't know what was going to happen to me in the next couple of days. And that was extremely hard on her. Also said she'd already seen hundreds of people just like me that she had to send home.
And I want to just give to my audience as a frame of reference, Mary Kate's from Queens, and Queens, if you remember, and Elmhurst Hospital became ground zero for many in this country to when it was at its worst with the freezer trucks and everything out attached to the hospitals. Even though you were in a horrible shape here, and I understood you even put an end-of-life plan, they couldn't even bring you in the doors, and technically you weren't even counted as a COVID case, right? Because they couldn't even do the tests on you.
No, and that's what I wanted to mention here. And so I never have actually even had a test. The doctor simply diagnosed me at the hospital. She, quote, said, "I'm 1,000% sure you have this. You can tell all your colleagues, tell them to, act accordingly, not to see anyone else, tell anyone you've come into contact with." She said, "I cannot give you a test at this time." Those were the directives they had at the hospitals at the time.
Obviously, you went through, and we'll talk about what the next chapter for you was like, but at that window in time, this wasn't some theoretical thing that you were going through alone. You knew a lot of your friends, will now look at that empty chair, as they say, in the kitchen, and a loved one's not there. You know a lot of people who lost people to COVID, don't you?
I have a lot of friends who lost family members, who lost very close friends. And again, a point there to be made, even just that this is my experience, and these are my anecdotes, but a lot of these people that were lost were my age, and people, again, who didn't have any pre-existing condition. And I was learning that while I was sick. And I, as you said, like I did in fact create an end of life plan and send it to one of my friends just in case, because I'll tell you, I really felt that I wasn't going to make it. I felt very peaceful and calm. And I understood later that was because my body was doing everything it could to survive. I honestly couldn't really have thoughts or feelings. So I wasn't scared.
So you quarantined for 5 weeks by yourself at home, and you felt better. Maybe not all the way back, but you felt better. And as said before, you went back to your old life. You started exercising again, running again. And then you had, when I say setbacks, that's putting it politely, as I understand that you had all different kinds of rashes. You had skin inflammations. You were bleeding. You described it as if you were having like a miscarriage every 2 weeks. And then you had, major setbacks, obviously, with COVID. And you felt like, I've heard so many people describe this to me, like they were almost underwater, that their whole body just they couldn't even raise their body. Talk about just the assault on your physical self that you went through.
I think there's not a lot of talk about what happens to women with this virus, or what can happen to women. And so, yes, I was experiencing just such insane, massive bleeding and blood clotting with my cycles, and they were every 2 weeks. And it was as if I actually have had a miscarriage in the past. It was as if I was having one. It was so dramatic, and I didn't really understand what was happening to my body. But yes, all the skin rashes and things like that, I was sort of dealing with while I was, again, like I said, running and cycling and playing tennis again. But then on July 1st, I was actually back in the ER. And so what the doctors thought at that point was that I had a much more major setback, even from those symptoms I just described through May and June. So what I've done in the last month is I've started to see a lot of specialists, and it has actually been amazing. They have been wonderfully supportive. They have confirmed that they're seeing people like me all day long, every day. And I also, at this point, would like to point out that great support from the Survivor Corps group, where I was learning all these things via all the members. There's about 100,000 members of this group at this point.
In dealing with the Survivor Corps, and we've talked to about a half a dozen long haulers now, everybody's got a different story, but some of the same both symptoms and concerns. Will I ever get all the way back? But they feel marginalized because people think or treat them like it's all in their head. And they talk about this fog they're in, and you talked about and gave an example of confusion that's not unique to yourself, that you don't know really where you are sometimes or what's going on around you. And it's struck me, at least, how many people have talked about the same kind of things they're going through. Describe for my audience, if you will, where you'll be walking down a street and things we take for granted, you're questioning.
Yeah, it's really been interesting. And that is something that I've seen has come and gone since I contracted COVID. And so it's really strange that, I could experience, for example, some of these times of feeling that I've disappeared for a little while, that I could experience back in March, and that it still may happen now, but it's extremely infrequent. So it does make you, to your point, feel like you're going a little mad. But to have the support of so many who are going through it, and now hearing more in the media and more from medical professionals that, no, this is in fact very, very real, and you are not crazy, and it's not in your head, and it's not anxiety. It's just so, reassuring for all of us.
First of all, thank you for sharing your story with us, and I know I speak for our audience. We wish you a speedy recovery, but again, thank you for getting awareness out. Mary Kate Boughton.
Thanks so much.
We'll be right back to wrap things up.